and Assalamualaikum. Welcome to International Seminar on Autism 2014. My name is Zainal Rashid Mahayuddin. You can call me Zainal. I am from Center of Artificial Intelligence Technology, Faculty of Information Science and Technology, University Kebangsaan Malaysia, UKM. So I'm going to be your moderator for this session. I wish to thank you all for gracing this occasion, and I'm delighted to welcome all delegates, representatives, local participants to this event. It is indeed a great pleasure to have you all today. So first of all, may I briefly introduce our guest speaker, Dr. Wu Yuyu. Dr. Wu Yuyu received her medical education at the China Medical University. She continued her studies at Southern Connecticut State University, majoring in special education. She works very closely with Taiwan Psychiatry and Taiwan Child and Adolescent Psychiatry Association. She also contributes to various non-profit organizations and became Committee of Mental Health Professional at John Tang's Foundation. So, without further ado, please welcome Dr. Wu Yuyu.
Thank you. Okay, so I only have 35 minutes to present, so I'll make it very brief and quick. So if you have any problem or questions, you can ask me later on, okay? The title was, on the program was using iPads, but that wasn't the intention of my speech. My speech is more focusing on the minimum verbal children. How do we help them to communicate? Communication is not just using words or verbal. Case for deaf children, they communicate with sign language. For for a lot of other kinds of handicapped kids, we don't use we not always use words or verbal language to communicate. So I'm here to share with you that how we do it for those very minimum verbal children, very minimum verbal children with autism to communicate with us using other things than words and than verbal language. I'm a clinician. I'm not really a research, although I do research, and I have published a couple papers, but my real job is a clinician. I have been seeing kids, 5 days a week in the past 27 years. So a lot of kids in our program has been working with us in the, for a long time, like 10, 20 years. So it's our privilege that we have been able to follow children from their 3 years old till they're 20 years old. So we have a lot of chance to see how grown-up kids will look like. So I used to work in the university hospital, but I started my own private practice 2.5 years ago. So now I'm working for myself. So this is my clinic in Taiwan. And we have a website if you are interested. So this is my background. Okay, this is where Taiwan is. Malaysia is just down in the south. And we're just next to China. So, and this is Taiwan. And we have the 101 building, which was one of the tallest buildings on the earth. And this is the puppy show in Taiwan. Okay, we all know that children with autism in the spectrum disorder, the ASD, they have various ability. And some kids are very sociable, and some kids, they just doesn't like to interact with others. They have behavior problem, they have communication difficulty, they have motor sensory, and if you use the measures, usually IQ test for the verbal kids, we have children in the profound disabled area, and we have children with very good IQ. So if we talk about children with ASD, we are talking about so different type of kids. They are not the same. They have, they are so different. But they all have impairments. So that's why we need to help them. At first, I'll share a little bit with you the program that we started in 1994. It was a hospital-based intervention program, and we tried to get the kids as early as possible. So the program is focused to be early diagnosis and early intervention. We focus on the symptom of the ASD children. We use the developmental and behavioral approach. We believe that the child is our the main client, so we try to promote a better development and better adjustment for the kids. And for the children to be able to get back to the mainstream. The mainstream means the family, the school, the society. And to be able to have a better interaction with the family, peers, and anybody else in the society. And we know that children are always belong at home. I mean, home doesn't mean they stay at home. I mean, children are in the family. So we tried very hard to empower our parents to help their children, because the therapists only see kids for 1 hour a week, 4 hours a week, 20 hours a week, 40 hours a week, but the parents see the kids all day long. 24 hours a day, 7 days a week, 365 days a year. And the parents will see the children for a long, long time. So that's why in our program, we're focusing on how to empower the parents to help them help the kids. And our program is very long program. So it's not 3 months, it's not 1 year, it's not 3 years. As long as the parents willing to stay with us, they can stay with us as long as they want. So that's why I have kids that we see at age 3, and now it's like almost 30, 20-something years old. They don't come to our program every day. They just keep the connection with us, okay? So our program is, this is the purpose of our program, and we try to help the children to be able to communicate better and to adjust to the mainstream environment better. And we think the child as a holistic thinking way. We don't treat the kids for one skill. We think the child as a whole. So as long as he or she needs for the environment, which we will try to help them. But help them, not just us. We work with teacher, we work with everybody else. So our program starting with preschool, we have school age and adolescent to the young adult. And for the younger kids, we have a more intense program, and the children comes 2 hours a day, 3 to 5 days a week. And for once the kids is able to go to the kindergarten, we will have the supportive program. It's like 1 or 2 times a week. And before the children enter the elementary school, we have the elementary school training program. And for children at school age, we will separate the kids to either with verbal or nonverbal. So the minimum verbal children, they will go on to one program, and for the higher functioning kids who has verbal ability, they might need social skill and other relationship, theory of mind, social skill training, okay? So we use behavioral, we use a lot of reinforcer, we use visual cues, we use a lot of encouragement for to interact with the kids, okay? So what we need to give the children, we believe that children with autism are not impaired mentally, are not intellectually impaired, even though they don't have language. So So we believe that they should have as many chances as all the other regular kids have, or even more. But nevertheless, they should have a lot of chance to learn. Okay, so we have the morning routine, just like kindergarten did. We do the cognitive learning, and we do the independent work, and we do the self-help skill, and we have some art and craft, just like school did. We have playtime and time for games. We have the preschool game to try to get a chair. Play games. We have free time that kids need to learn. In order for them to get back to the mainstream, they have to learn all these kids with skills. And we have birthday party. We have all kinds of parties. A party again. And we have show and tell. We have field trips. Everything. But in our program, as I said, that in Taiwan we don't have a lot of therapists, so we have the parents help us out as the co-therapists. So in our program, we always have one more adult than kids, because every kids have one parent or even more, and the therapist as an extra person. So kids can get a lot of help from adult. There's another field trip. So this is our therapist, and this is the parents. So this is how we help the parents. But still, we have individual training in small group, because the kids keep on grabbing stuff. So mom just hold up the hands so he can learn. Okay. So what's the effect of our intervention program? Actually, the subject in our program, the intensive program, the age is much younger, and supportive program, the children are nearly 6, and preschool programs, 6 to 7 years old. And this is the outcome that we did in 2002. The pre-training assessment, 9 months and 18 months. So when I share with others about early intervention, I always say that you have to look longer time. So the outcome will not be very effective if the program is too short. And parents might get very frustrated if the kids not making a lot of progress in the beginning of the training. So I always tell the parents that we need to wait and give kids more time, and they will pick up. And this is also the outcome that we did in 2002. Once the kids went to the elementary school, we just do the IQ test. Some kids might have a good IQ score and verbal IQ or performance IQ, and they can be included in the mainstream. But some kids, they might not be able to have verbal outcome. So for those with verbal ability, they just move on, to the mainstream. But for those without, how do we help them? Okay, this is our low verbal school-age children, and you can see kids are using computer now. Okay, we start to use computer because they cannot speak. You have to give some method for them to be able to communicate. Okay, this is for. But there are 30%, as in the morning Connie mentioned. Actually, this is from her paper, that there are 30% of children with ASD, no matter how hard we tried to help them to communicate with verbally, but they just can't. So there are 30% of the minimum verbal children who can not speak, or they have minimum, they have restricted phrase, or they can, only echolalia. They cannot have a fluent verbal ability. So we have to help them to communicate. So what kind of intervention will be effective for them? Okay. Okay. So since we know the kids for a long time, we know that the input, we try to put information to them, it's not hard at all. They learn. They just, show you, as Connie said, they will write at the wall, even though they cannot speak. As we saw yesterday, the one who can play piano, I don't think he's very verbal. Maybe I'm wrong, but but he is very talented playing piano. So we know the input is okay, but what happened to the output? Kids cannot use verbal to talk to us, so we will have to try to help them. So for the expressive language, on our way to help those children to express themselves, we say to help them with the verbal. In the beginning of our training, we try to speak out what the kids was trying to say and help them to understand the meaning of the verbal words to the concept. But some kids just cannot do that. So we have to shift. We have to shift to pictures or words. I know a lot of therapists here must know the technique about PACS, picture exchange. We use pictures to help them, okay? So we try to find a motivation for the kids, and we try to increase their intention for communication. Some kids can go on to verbal, some can't. If they cannot if they cannot have verbal, we try to use the nonverbal communication means. That means gesture, pictures, and ICANN is a software I will share with you. We use words, picture, writing words, or typing skills. Okay. I'll just skip this one. Okay. So this is PACS. And you know PACS, right? A lot of people must know PACS. And this is very heavy. If the kids knows a lot, you have to bring a lot of cards. So with the modern technique, we have this one. This is called ICANN. Actually, you can use iPad or any kind of computer. So I'll show you a little bit about ICANN.
Hi everyone, my name is Steven, and I'm going to introduce to you an app today called ICANN, and it's for parents with children with autism. And a lot of kids with autism usually have trouble communicating verbally, and usually parents have to make these cards with pictures on them in order for the autistic kid to be able to put it together to make a sentence. But what usually happens is, since they have to make everything by hand, it takes a lot of time, and it's usually very hard for the autistic children to find the right card in order to effectively communicate their needs and necessities. So with this app, that problem can probably be diminished. So let's check it out. So on the left-hand side, we have different categories. The first one being transportation, second being household and furniture, third one being different moods and emotions. Fourth is different people, such as father or mother, different body parts, different needs and verbs, and different food items. So what you need to do is make a sentence by dragging the cards from the categories down to this section below. So let's choose 大家, everybody, a verb, 要, want, and let's choose a food item. Sandwiches, 三明治. So once you've chosen your sentence, you can just simply press the play button right here on the left,
大家要三明治。
Okay? And if you make a mistake, it's fine. You can always click the erase button in the middle. But if you do need a sentence that you commonly use, then you can save it here with this button. Another very, very helpful part of this app is, on the very left here, is you can make your own cards. It's just like the parallel to making them by cutting them out and making cards manually. So here, you can make new cards. Click the blank space to take a picture. Let's take a picture of my bracelet. Okay, so once you focus it on the bracelet, just type in the name of the card, and also you can make an audio recording. Bracelet. Bracelet. Once you're done, just click the done button up here, and the card will be part of your collection. And you can find it under people 角色. So let's make a new sentence. 大家, everybody, 要, wants, and the card we just made, bracelet.
大家要
bracelet. Okay, and if that's the sentence you usually need, then you can just click the save button, and then it'll be saved under your commonly used phrases. So hopefully this can solve lots of problems with verbal communication with autistic children, and hopefully that a lot of autistic children will be able to effectively communicate their needs and be able to successfully live their lives like normal kids.
Okay, this is the first version. So it has a lot of problem because for one, for little kids, they cannot do the drag. You know, they just, you know, touch every pictures they want to see. So actually, this is we started this software in 2011, and now it's 2014. So we made a lot of change, and we make it easier and more colorful. But it's just an idea, because in Taiwan we speak Chinese, we don't speak English. We cannot use any kind of software from United States, so we have to find something else for ourselves. But by using the computer for younger kids, or even for the older kids, we have to be very careful, because children with autism, a lot of them doesn't like to play with us. They prefer the modern technique much more than us. So we have this computer only for communication. We block out all the other, you know, high tech. So once they use this computer for communication, they cannot get online. You know, they cannot go to YouTube. Otherwise, they just go on to YouTube and to see whatever they want and ignore us. So this is the I Can that we did for younger kids. But we only use for a very short period of time, because later on we know that picture is, you know, it's too troublesome for taking picture, even though it's much easier than before. Than the packs, you don't need to cut out the cards, but it's still too much trouble. So then we move on to words, because words is much easier. You can just write, okay? So we, besides, you know, that things doesn't happen overnight. Before we used in combining use the modern technique, we still have to train or help our children to build up the ability of communication. Okay? So communication is back and forth. Communication is not one way. It's not always, I want cookie. They have to, you know, to you know, maybe if they say I want cookie, I will say what kind of cookie you want, and can you wait? And maybe the kids will tell me, no, I don't want to wait, I'm hungry now. That's communication. It's not just one way. So it's back and forth. It's listen, then answer. It's giving choice. It's the communication is, to tell emotion, to solve problems. So we have to build up other skills other than just knowing the name of the object. So this is another example that we use words to help nonverbal or minimum verbal children. So this kid likes to write. He likes numbers. So the therapist will put books or write words right in front of him, so he can make choice. When he pick up right words, the therapist will just write words for him. And if he pick up, so there's another right words, so we'll do again. And if he pick up books, and the therapy will just give him the books to read. So we go on. All this kind of technique use verbal, use I can, use words, writing words, or use computer. It can always go together. It doesn't mean you stop one thing and do another. A lot of our parents will be afraid. A lot of parents are afraid that once we use words, these kids will stop using verbal. No. Just like, we learn two languages. We don't forget our, either one. Maybe one is better than the other, but we won't just forget. Once we learn English, I will never forget Chinese. Actually, Chinese is more convenient for me. So the kids has a lot to express, so we cannot just stop at words. I mean writing words. It takes a long time. So we try to expand their communication skill. We use typing, okay? This is how we started. If the kids want something, they will have to learn. This is the alphabet in Chinese, so they have to learn just similar to the keyboard in Chinese. They have to learn 一ao要, that means want. So this is the first version we made 13 years ago. Okay, nowadays we just let them bring the portable keyboard around. And for the younger kids, because they still throw things away. If you just give them the iPad, they just throw away, and that costs a lot of money. So a lot of time we just give them a portable keyboard. But once the child is much stable, we can use the iPad and move on to computer and everything else. Okay, and so what are those kids that we use words to communicate other than verbal? I just calculated that there are 40, actually we have more. I just have 40 kids who has done the ADIR, that's the standard diagnostic tool. 22 of them are nonverbal, 18 of them are nonverbal, and 22 of them are verbal. Among those 22 kids, only 3 of them have verbal IQ over 70. Other 19 children with their verbal IQ is less than 70. Usually it's around like 60 or 50, but 18 of them are nonverbal. So they have the, if we use the ADOS, we can know that the score for abnormal social communication or repetitive behavior are all very high. See, this is the cutoff point, 10. Our kids is between 17 to 30, and cutoff point 8, 7, 3. All our children are in more severe ASD group. So we help them to use other means to communicate. If they can use gesture, they use gesture. If you use PACS, they use PACS. If they can use cards or typing or verbal, whichever that help them to communicate well, okay? This is the IQ score for one boy. If he used verbal IQ test, and his verbal IQ is 69, and if he used computer, and his verbal IQ can be up to 95. What we want to see is the best ability of the child, so then we can know how to help him. Okay, so if we use the words that we can help the child to include into the kindergarten. Okay, let me see. Oh, this is a preschool kid. This is how he reads. He just turn the page. We have a lot of children with ASD. They just turn the page and never read word by words, right? Because they have the picture memory. They just read with one snapshot and they read the whole page, right? You see that in our children? And after that, that's the mother's voice, not his voice. So the mother just will will say whatever he was trying to type and make the sentence. Okay. So the kids can go to kindergarten, and the teacher knows that he's using words to communicate. So, and this is a little girl. She can communicate with peers at school. Okay, there's another good boy, and you can see the autistic behavior, right? Tapping on stuffs and paying no attention and without good eye gaze. But he's a very anxious child. So this is a workshop that we gave in Taiwan. He was answering questions with the audience, because he's a very anxious child. So one teacher just asked him, "How do you calm yourself?" He said, "My mother told me how to be patient, and I try very hard to make my will and my behavior together." That's what he answered. And there's another kid, is 8 years old. He has no verbal at all. He only used typing to communicate. So his mother asked him, "Why you turning objects all the time?" And he'll say, "The turning objects take me through my loneliness," because he has difficulty to interact with others. So this is him. And so the mother was sharing his experience with the audience about his training process. And he was, because he was just type out that to the audience and to his mother, that you didn't say that I'm very sensitive to your needs. He used 体贴. I don't know how to translate in one word in English. So he was correcting his mother during the workshop, while his mother was trying to express share his experience. You can see the children who can type, who can communicate, they have better affection. The affect they share, they have a better affect. This is another kid who's autistic, without eye gaze, of course. And, and she is very anxious, and she has to hold up to something to calm herself. And when the audience asked him that, how can we help you when you are anxious? And she just type out, say, just give me a hug. Okay, so they can communicate, okay, and they can go to school. And this is another kid who's somewhere here. Oh, here. Okay, and her effort was recognized by school and giving him something. And this is another one. He goes to regular junior high school. He's nonverbal, And this is his mother, in case he need the support. In Taiwan, we don't have all the, we do have some support system, but not every day, not 24 hours, 8 hours a day at school. So this is his chair at school, and this is his mother's chair. And once he is in the regular school, he can attend all kinds of activity at school. That's our goal, okay? And this is his project, using 10 chopsticks to hold up to the drinks, see? And his mother and his classmate help him to build, because he also has the motor issue. He's not very handy, okay? But he type out how he want to design, and people help him out. Okay, I just skip this one. And this is another boy. He's in special school.
就是
Okay.
之昂
The therapist say
长
what he was typing, because he's nonverbal. Okay. And he say, I'm autistic. I want to write my story. I'm 14 years old. I'm smart. I'm gentle. I take everything seriously. I take every day seriously. I don't need to be treated specially. I want equal human rights. Okay, this is his drawing. We also have one boy who published a book, and he is nonverbal. He cannot speak at all. Okay. And when we talk about autism, we always say children with autism have difficulty to the emotion, to empathy, or they have difficulty in understanding others' emotion. But for those nonverbal children, we found that once we help them to communicate well, we can see a lot of passion within, okay? We have a girl who is 26 years old now, but that was a couple years ago. Her art teacher passed away. So she drew a picture of her art teacher, and he typed out that her feeling to the teacher. This boy is 21 years old, and he's in the institution, and because he graduated from the special high school in Taiwan. But he's nonverbal, but he can type. Okay, you can see he's not very good with taking care of himself. He doesn't care how you look at him, so he doesn't cover his mouth while he is eating. But he can write, okay, and they show interest to to female too. When they see these pretty girls, and he type out that the sister is very pretty, and I only angry that I'm not very smart. Okay, and because we know these kids for a long time, and they have been in our program for a long time. So there's one girl who's minimum verbal. Autistic girl. She likes another boy who is also autistic. So it's liking you wrong. Who protect you 1,000,000 times? It's me. Who told you told the world wants to marry you? It's me. Who withhold and disturb in life is me. Hold a red thread. In Chinese, you hold a red thread. That means you engage or got married. Hold a red thread tight. The affection is me. And the other boy was laughing at him, laughing at her that, because she typed this affection words to another guy, to the boy, and he doesn't care. And there's another boy in the group just laugh at her, and she just typed, it's none of your business. Okay. We believe that every kid with ASD are very unique. Actually, using words to help children to communicate other than just verbal has been happening all over the world. and children with nonverbal ability ASD, have been published in books. This is in United States. This is in Taiwan. This is in Japan. This boy is in Japan. And in the morning session, story was shared in the audience, from the audience too, that a boy in Malaysia who can write very beautiful articles. So we believe that there are different subtypes of ASD. For those nonverbal children with ASD, we believe that they have a very serious language communication problem. It's a brain injury. Also, they might combine some sensory or motor issue because those very a lot of nonverbal children, they also have difficulty in fine motor skill. And these kids are always anxious, so they have a lot of behavior problem due to their anxiety. And we believe that children with ASD, although nonverbal, they have no problem in retaining information, so they can learn. I have kids who, told me to go to hell because I say he's retarded. He typed, So they have no problem in retaining information, and cognitively they can learn, but they have a very difficulty verbal communication problem. So we believe that for children with ASD, we have to help them to communicate well through various media other than verbal. Okay. This is my team, my mentor, and my colleague, my best friend at work, and thank you very much.
So thank you very much to Dr. Wu. Now it is a time for Q&A session. I open the session to the floor. Any question? Only 3 questions, yeah? Okay, first question.
Hello, I'm Baizura from Malaysia. Have you had patients who are minimally verbal? They do say things, words, minimal phrases. And once you started on this, have you ever started on this? And when you start, do they regress in their verbal or do they improve? They improve.
Some of them. But if they are nonverbal, what I meant, they have the brain, the verbal area in the brain are damaged. So some children with ASD might not able to speak, no matter how hard we tried. But if you use the words or any other media to help them to communicate, the verbal will just improve, maybe a little, but not a lot. Yeah.
But will they regress and stop talking because they find it much easier to use the computer? Because some of them actually is an outlet, because if it's all of us treat autistic children, they know they're very lazy. They choose the easiest way out.
They're not lazy. We all are very lazy.
I think anybody, the smarter you are, you find the easiest way out, isn't it? So the easier way out would be to type the thing.
If you give me the choice to use Chinese or English, I will use Chinese. Right?
The easy
to
one.
speak.
Yeah.
Too easy. But I will, for you, type is easier or use verbal is easier?
For them, typing is easier than verbal.
No. Use verbal is easier. If they want to type to communicate with you, they have to pull out the typewriter and they have to open it and they have to press, I want cookie. If they can speak, 我要吃饼干, I want cookie. Why they bother to take out the computer? So verbal is always easier, but they have difficulty to use verbal. So don't worry about it.
Okay, thank you.
Okay, second question. Wait.
Good morning. Just Is it afternoon already?
Yes.
Anyway, I'm Rohani. I just want to ask, I'm a grandma of an autistic child. I just want to, just a simple question. You said that just now, that autistic children are always anxious. Does this apply to every one of them? Are they always anxious?
A lot of them. They have a lot of cases. We have a topic about anxiety with children with ASD in the afternoon. Yeah, they have, you know, even for, we did research years ago, even for the baseline, they have a higher sympathetic tone.
So when they're tapping or something like that, are they anxious, showing that they are full of anxiety?
No,
Or not always, it's not always.
in daily life, they show high anxiety.
How do you know that they are full of anxiousness, or they're in anxiety? How do I, as a grandma, recognize that feeling, that emotion? Thank you.
Okay, thank you for the questions. I think we can tell each other whether we are in anxious or not, right? You can learn from the tone of their speech. You can see their behavior. If I'm anxious, I always pick up my fingernails. Okay, everybody has some ways of comforting themselves with their anxiety. Just maybe 2 years ago, the IBM Bill Gates was caught to shake hands with others while he put his hands in his pocket. It was said that it's inappropriate, but they found out that Bill Gates shake hands with anybody with another hand in his pocket because he's too anxious. So anxiety is, you can see by the behavior of anybody, yeah, including children with autism. Okay, if they run around, if the kids cry, if he run around, and you know, even though the young kids I just showed that he turn objects, tapping on stuff, we always interpret it as a stereotype behavior. But you can see all this stereotype behavior increase when they have nothing to do or they are very anxious. Okay. But once the children can tell you, you know, either with verbal or other means, they will tell you that, you know, they feel anxious. Okay.
Okay, third question.
Dr. thank you for being here. I'm really impressed by the video that you showed us that how the children use the keyboard to communicate a question. I'm working with children with special needs, and I'd like you to share more information on how they use that and where do you start and what are the resources and where are these resources where we can access and we know that teach us how to use that so that we're able to apply it or use it on children so that they're able to express themselves in such a beautiful way. Thank you.
Well, the resources are everywhere. Okay, everybody has a computer, right? So for younger kids, we use a lot of pictures. Okay, we not just directly go to the computer, because even for the younger kids, for the typical developer kids, you don't give them computers too early, because they have their whole life to use computers. So we use a lot of pictures. We use a lot of visual cues in the daily life. You know, if they want apple, we just show them picture of an apple. And, you know, for some kids, they might be able to go on to have a verbal ability. For those without, we will try to, you know, besides showing picture of an apple, we show words with apple. So they can learn picture and words together. And maybe later on, you know, as they grow older, we know that, you know, they know the words, and we will move on to typing.
So it's like you can start with PACS first and
Yes,
then move
yes,
on. to
Yes.
words and pictures and moving on
to computer.
Thank you.
Right. And the software that we use, because we don't have a lot, we only use not a long time, maybe less than 2 years for the kids with the software, because we move on quickly to the words. Even just like we use iPad, we don't PACS. We don't use PACS for a long time. You know, we just try to move on to next step to communicate.
Okay. I will accept one more extra question. Anybody?
Just would like to ask about gesture communication. Is it very limited for them to communicate? Because I have been practice a few gesture towards my son, but it's not automatic. Will show you what he wants. It's only 1 or 2. So I feel gesture is very limited.
Yes, yes. I don't know. Maybe other therapists will have the same experience. They have a problem in integrate their movement too. So they are not like deaf kids. Deaf kids can learn sign language, but children with autism, even though they can learn simple sign language like down, more, I want, but still very limited. Because they have the difficulty in integrate the gesture.
But he's no good in academic and even though recognize picture. So I was thinking very hard how to communicate with him. So, but the understanding level is okay. He can hear what I say. He can follow instructions, but he cannot express. So, what do you suggest for this kind of children?
Use words.
Words.
Use character.
He's not good in
No,
writing.
That's why we use computer. Oh, I forgot to show you just one clip, okay? Let me show you a clip of the boy that who went to the examination. For, let me see if I can run this one. This will be the last one, right? Because we have to end it at 1. Okay. Oops, sorry. I think I had it somewhere. Okay. Okay. Yeah, here. This is how he takes the test at school. Ooh. Oh, sorry, I can't. No. Don't know what happened. Okay. Oh, okay. Sorry, I gotta. No, it can.
Okay, last
Yeah.
one question.
Yeah, thanks.
Yes, please.
Yeah, Dr. Wu. Chow, I got a son of 10 years of mild ASD. He usually log into YouTubes and look for rhymes songs, and he sing along with the song. Do you consider this as verbal progressions or progressive?
You mean he can sing
Yeah, he
songs?
sing along.
Songs,
Do you consider this as a stage of verbal progressive?
progressive in verbal? Yeah,
Huh?
sure. But can he communicate? He can sing songs, doesn't mean he can communicate. Because we have a lot of kids who can recite long, books, video, they can recite.
He's
But,
very minimal verbal.
uh,
Yeah, I just want to know, is that a forms of verbal progress, he should
Progress.
allow
Yes,
or
yes.
encourage?
He didn't, before we do, we have to have the concept of communication. What does it mean to communicate? He play with songs. Some children with autism, they play with words, like they recite. They can recite a video.
Yeah, I understand what you mean.
Yeah.
It's not recitations.
Right, but they
medium-
cannot communicate. They will not
Communication
tell you what they
very-
want.
it's
So we
very
will try to help them to understand how to communicate. If he can recite songs, he can sing songs, we can build up the bridge of communication. I think it will be very effective for him.
One more question. Last one. He's studying in a Chinese school. What we learn now is modern Chinese, right? I don't understand Chinese anyway. But he writes classical and modern Chinese together. He mixed it, which he doesn't learn classical Chinese. Do you think it's good to allow him to continue that way, or should we stop him from writing those classical Chinese?
If he has nothing to do, you are not interacting with him, that's his hobby, right?
He writes like, I don't know, poems or letters or essays.
Yes,
things
that's
like that.
his hobby, so he can do that. But, besides that, he has to learn how to express his needs in daily life.
Some I see is in the forms of expressions.
Okay.
Or his,
That's very nice.
you
Sorry.
think he should be allowed in that way?
If that's his hobbies, yes.
Okay, thanks.
Sorry, we need to stop now. Okay, thank you very much to Dr. Wu. Thank you very much for your participation in this event. I hope you enjoyed the program, and I look forward to your participation in the future events. Finally, on behalf of Organizing Committee International Seminar Autism 2014, we would like to express our deep appreciation and thank you very much to Dr. Wu in participating in this event and sharing her knowledge and experience with us today. So thank you very much. Okay. So don't forget that, please bear in mind that concurrent session this afternoon will start at 2:15 p.m. 2:15, okay? Thank you very much.
Thank you.
I would like to ask you more questions. So,